Hi there, welcome back to UWorld's question of the day. We are back on day 4 of ECG week. Thank you for joining. Let's jump right into our question today. So the nurse is caring for a client who is experiencing the cardiac rhythm in the ECG strip shown below. The nurse should recognize that the client is experiencing. Go ahead and read this strip. Let us know what you think. Drop your answers in the comments below. We want to hear from you guys. And let's get right into our correct option. Our correct option is going to be option number 4, those premature ventricular contractions. So let's look more into this. Characteristic findings of those PVCs, or premature ventricular contractions, are going to be a variable heart rate, so that R to R interval is not going to be consistent. We'll also have an irregular rhythm, which means that the transition from the atrial electrical activity on the ECG to the ventricular electrical activity on the ECG will not be smooth. This irregular rhythm will look like a hidden P wave within the QRS complex. Essentially, an out-of-sync jolt in our ventricle is going to hide that P wave. So since our P wave is hidden, we're not going to have a measurable PR interval, and the QRS is going to be wide and distorted. Remember that that QRS complex should be less than 3 small squares on these strips. So when the QRS is greater than that, we know it's indicative of a ventricular problem when that QRS is wider than those 3 small squares. So 1 PVC, it may not be anything to be super worried about, but 3 or more PVCs can lead to ventricular tachycardia or VTach, which we also know can progress to ventricular fibrillation, or VFib, which is a life-threatening dysrhythmia. So we would want to intervene quickly here. So again, our correct option is option number 4, premature ventricular contractions. Thank you so much for tuning in, and make sure to stop by again tomorrow.